Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about one of the ways that we use to test for peripheral neuropathy. So over the last 60 days or so, we've been actually talking about peripheral neuropathy and giving you lots of different options, lots of different ways to understand it, control it, manage it, and so forth. But let me give you one of the simplest ways that we can actually test for peripheral neuropathy, and it's called a Semmes Weinstein Monofilament. This is basically a small little filament that creates 10 grams of pressure when it touches the skin. And this should be easy to feel. It should be enough pressure that you can actually feel it on a normal sensate foot, a foot that doesn't have peripheral neuropathy. So basically what we do is we touch the bottom of the foot, and we actually do this to test 10 locations. We test the bottom of the big toe, or the hallux, the third toe, and the fifth toe. Then we test the first metatarsal, third metatarsal, fifth metatarsal. Then we test the medial arch and the lateral portion of the foot in the area of the arch. And then we touch the heel, which is 9 spots. And then we touch the first interspace on the dorsum, or the top of the foot. The idea is the individual with their eyes closed should feel each of these touches and know basic location and that we're touching their foot. It is very, very important that this test be positive. The reason this test initially was being used was in diabetic peripheral neuropathy to prevent injury. Because if you have that much sensation, if you say, okay, I can feel that when that touches, it's enough pressure to prevent a wound or a sore in a foot, say in a diabetic type foot, so you don't get the wound from stepping on something that you don't feel. So why would that be important? Let me give you a little bit of a background with a little bit of a story. One of the things I do with my diabetic patients that have peripheral neuropathy is tell them that they should be checking their foot on a regular basis. The American Diabetes Association says they should be checking their foot at least once a day. I like to double that. I tell them they should be checking their foot before they put their shoe on and after they take their shoe off. The reason why is they can look for any changes. Is there new areas of redness or new areas of problems going on? The biggest reason that I do that is to know if there's a problem in the shoe that may be causing increased pressure or problems or so forth. That being said, it's also, if you have a neuropathic foot, a foot that doesn't have any feeling, that you check your shoe before you put it on, make sure there's not something in it. There are individuals, a patient that I knew that actually was able to walk in their shoe all day with a little Fisher-Price chair inside the shoe. So they had pressure that whole time, but they didn't feel it because they had no feeling in their foot until they took it off and their foot was bleeding because of the big sore and wound from all the pressure they had that whole day walking on that thing. So the idea is you want to make sure that your foot has normal sensation, because if it does not, if you take the Semmes Weinstein monofilament and it doesn't, you cannot feel it, it doesn't cause you to say, yeah, you're touching me there, then you know that you need to be a lot more careful with your feet. You need to be a lot more careful about what you touch and where you walk and what you're doing, because you know that you cannot feel the bottom of your foot. And because you cannot feel it, you can injure your foot much more easily. This is Dr. Brandt Gibson. This is your Neuropathy Nugget, day 61.